A mallet finger is a common hand injury among athletes, especially basketball players. In this video, I'll explain what a mallet finger is, how the injury occurs, and what the common treatments are. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, a mallet finger it's a surprisingly common injury, even though people don't always recognize what it is. Typically what happens is, and it's usually in athletes because it's some sort of ball or other projectile hits you on the tip of the finger, and it hits you suddenly while your finger's extended. And that traumatic force of being hit on the tip of your finger can rupture the extensor tendon that attaches to the end of the tip of your finger, what's called the distal phalanx, the part that basically helps the tip of your finger straighten out. And so that tendon is no longer attached to the bone. And so now you've got, see if I can demonstrate this without actually having one, you've got a tendon or a distal phalanx, basically the end or the tip of your finger that's bent down, and you have no way to fully straighten it short of doing it with your other hand. That is a very, very tricky injury. It doesn't seem like a big deal, but the trick is if that tendon doesn't heal back down to bone, that joint basically gets stiff, and then it's really, really hard to ever be able to fully straighten out that fingertip. And so when that happens, it's worth seeing an orthopedic surgeon or a hand surgeon right away. Now, fortunately, you usually don't need surgery. That tendon will heal down to bone, but the key is that you basically have to keep that finger out straight, usually with a splint or some type of finger brace that holds it out straight, usually for a minimum of 6 weeks. And I mean perfectly straight or even a little bit hyperextended. And that's sort of a pain when you're talking about washing your hands and things like that, because you have to keep that straight. If you basically come out of the splint or brace and that finger bends again, it disrupts the healing tissue of that tendon and you have to start all over. Sometimes if for whatever reason it's just not healing, the hand surgeons will go in and do a surgery to reattach it. Now there's one type of mallet finger that almost always does need surgery, and that's what's called a bony mallet finger, where in addition to pulling the tendon off the bone, it pulls a piece of bone with it. And if that piece of bone is big enough, that joint is no longer stable, and the rest of what that distal phalanx doesn't stay in place. That almost always needs surgery. So if you suffer an injury where you're hit on the tip of your finger with a ball, or maybe you're sliding as a baseball player, sliding into base and you hit the tip of your finger, and now you can't on your own get it to fully straighten out, whether it's your middle finger or your ring finger, it's worth seeing a hand surgeon as quickly as you can, because it may involve either a short outpatient surgery or a brace for a fairly extended period of time to get that to heal. But you want the diagnosis made promptly, correctly, and then the treatment to start so that you can get back to what you want to do, hopefully as normally as possible going forward. Now, I'd love to hear your experience with your hand injury, so leave those in the comments below. Just understand, if you leave a question asking for medical advice in the comments, I can't offer you specific medical advice online. But what I do is I try to address that topic in future videos. Make sure to subscribe to my channel and click the bell to be notified when I do release a new video, hopefully about your topic, and when I start my next live stream, such as my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.